Well, good evening, medical students. So for my MAs, my dental assistants, and I believe we may have some pharmacy tech students on the line too as well. I'm going to start by introducing myself and who I am. So I'm Rose Olague. I'm the manager of DA strategy and school relations at Pacific Dental Services. I've been an allied health professional or in the healthcare profession going on 13 years now. And believe it or not, I started as an extern. So as very many of you guys are starting your journey, I was in those seats 13 years ago and never thought the career I would have a decade later. So I'll summarize in a short little preview of what I've accomplished as a dental assistant. So that is the role that I play as an allied healthcare professional. I was 17 years old, graduating from high school, and my priorities were prom and graduating from high school and celebrating it. Little did I know that I was starting my career, not just a job. Right out of externship, I was hired as a dental assistant for an organization called Pacific Dental Services. We are a DSO, so dental support organization. So jot that note down if you've never heard that term or that acronym for any DAs are on the call. I really want you guys to jot that note down because there's going to be numerous paths, whether you're an MA, a pharmacy tech, or a dental assistant that you guys can embark on when you guys choose your employer. So long story short, I've grown as a dental assistant here in the state of California. Southern California is my home. I've completed my undergrad in psychology, went on to complete my master's in management, and now I'm pursuing my PhD. Why I want to go back to school for almost 5 to 7 years, I still don't know and haven't wrapped my brain fully around. But I definitely can relate to all of you students on the call because I was an evening student. So I'm going to try and keep it short to be entertaining and impactful in the next 45 minutes with you guys because I know what it's like to sit in a classroom, especially when you've been at work all day. I do quite a bit of work also too with community outreach. That's one thing I really encourage as an allied health professional, that you use your professional, clinical skills that you have obtained through your college, but also to give back to the communities you serve. Through the PDS Foundation, I've been able to give back locally, regionally, and nationally. So some of the work I've been able to do over the years is be the mentor for a scholarship that we have for dental assistants. I've been able to travel across the country in our mobile dental clinic. Our mobile dental clinic, when we're not in a pandemic, gives dentistry or provides dentistry or access to care to communities that may not be able to get it, or there's not as many dental offices in that community. And then on a national level, I've traveled to Guatemala to be able to provide dentistry for those families there, and also be able to provide clinical expertise when it comes to working as a dental assistant, because we are able to train and develop and take part in developing dental assistants and also dentists in there. But I've done quite a bit over the last, I think one of the biggest accomplishments that I have had in the first decade of my career is I've gotten involved in legislation. So many of you guys may find that as a path. And when I say legislation, I sit on the California Dental Board. So as you guys grow in your guys' careers, you guys are going to learn about nursing boards, there may be a pharmacy board or advisory board, and those groups of individuals are handpicked or selected from the governor, and then they are able to oversee processes or licenses and be able to protect. Our number one priority is always to protect the public, and that is what we do amongst other things. But I was able to sit, and I've been on the board for around 2 years. So who knows, maybe a few of you guys will go into legislation, and that will be what your career path holds for you. So one question that we love to start every workshop with, or anytime we talk to allied health professionals, it's, what do you want your dream job to be? And I know that there's numerous classrooms that are chiming in today. So if we can just have a few ideas. And when we say dream job, you guys are going to have something that you aspire to be 3 years, 5 years from now. I'm looking to, go back to PA school, or to become an RN, surgical tech, to, advance my clinical skill set in this area as a pharmacy tech or as a dental assistant. But what I really want to hear from you guys is, what are you looking for in an employer? Right now, many of you guys will enter the workforce, and you will be working in a pandemic. Very different than how I entered the workforce, or many of us before. What's important to you? What qualities, what attributes are you looking for your employer to have? You can definitely take them from the slide or the board if you would like. But I just want to hear a little bit from you, and then me and Sam will chime in on some keys that may open your eyes if I never thought to look at that when I'm seeking an employer. But we'll take a minute, and if you guys want to shout out over the mics, you're more than welcome to. Perfect. Communication. We saw that come into the chat. I'll give you guys about 30 seconds. Room to grow. Love it. Yes, absolutely. From our MA students that are in that classroom. Money. Yes, thank you for not being shy and putting it out on the table. What is my base pay or what is my base salary? Teamwork, benefits, flexibility. We'll talk a little bit about that, Jenna. I really want to know what your definition of flexibility is. I think that word is very broad, and it's very important for when you're working with a recruiter or hiring manager that you're able to articulate what is the flexibility or type of flexibility you're looking for. Turnover of staff, very good. Positive work environment. Hey, you guys hit it on the nail. My students say scheduling flexibility. Okay, we're going to talk about that, Jeanette, because I love how you guys said scheduling flexibility, because what if you want to go back to school and you still need to work full time? How was I able to go to school full time and work full time? Because I did have to do that. I wasn't able in my situation to go to school full time without working. So I definitely had to have schedule flexibility or a team that was going to provide that. Let's start with career advancement, because I know a few of you guys said, the room for growth. And I'm going to bundle career advancement with coaching and mentorship. When you guys hit the gates running and you're looking for externship sites, please have a voice in that process. Do your research, put the time in. And the reason I say this is you just went through X number of months of school. And when I say X, some of you may have went through 9, 12 programs do vary in the amount of education you complete before you go on for your hands-on training or in-person training at a pharmacy, at a medical office, at a medical group, at a dental office. And with that said, you want to ensure that where you're going for the last stretch of your education, that you are going to be coached. You are going to be able to fine-tune the skills that you have learned in the classroom setting and be able to advance and ultimately land a job in the industry. So please make sure that you guys have a voice in your externship and do your homework. What you're initially looking for when I work with entry-level healthcare professionals, you're looking for a lot of coaching. You want guidance on how to do this procedure, how to communicate or articulate post-op instructions, pre-op instruction with your patients. So that is very, very important. I love that someone put into the chat right now, good practice management in the vet hospital. I love that, because yes, my little Max just had a surgery, and I can tell you his nurses and RNs that work with them, yes, practice management is huge. So you guys are looking for coaching and mentorshipping. In one of the questions when you're in the interview process, I would encourage you guys to ask is, once Susie completes your interview with you, ask them, what does my first day look like? What does my first 90 days look like? You're going to be able to hear, and if you do not hear, one-on-one coaching, you're going to be working with so-and-so, you're going to be getting coaching for X clinician. You then need to make the decision, is this the right place for me to advance my clinical skill set? Along the lines, once you complete externship, now the picture gets a little bit broader. There is going to be opportunity for you to maybe grow with this organization that you're deciding to start your journey with, or you may have to start your journey there to build your career and then pivot yourself 18 months into your career. So always look at that and ask for them, as a dental assistant, as an MA in your organization or at your practice or medical practice, what does career advancement look like for me? Or where are the opportunities for growth in this organization? That's a fair question for that hiring manager or that recruiter to be able to respond to you. Or what does the most successful MA look like in your organization? What does a successful dental assistant look like in your organization? The list goes on and on. The other thing is work environment. Hands down, team, please take the time to, do your research. We're going to give you a few tips on where to go for that research and look at, is this somewhere that I want to be at 8 hours plus in a day, because you spend more hours at work than you guys will even spend at home with your family. And then I want to talk a little bit about total compensation, and I'm going to ask Sam to chime in with me once we go over the wheelhouse of what total compensation is. But I want you guys to write that word down for me today, please. Total compensation, because I think when we think of money or income, we don't really always think in our mind, okay, what is included in that wheelhouse when an employer is looking at total compensation, and the base pay is really just a piece of the pie. It's a large piece of the pie, but it's not the entire piece of the pie that I'm going to be getting from this employer as benefits. So you have your base pay, and we'll give you a few tips of where to go for resources to look at base pay. You have that as a piece of your pie. Then you have this benefits piece of your pie, and benefits can include anything from medical, eye care, dental, 401k, the list goes on, and benefits there depending on the organization. I mean, we have pet insurance in the organization I work for, but the list will go on there. So that's your benefits. Then there's something else I want you guys to look at and explore, but it's time off, or how do you get compensated for vacation, floating holidays, sick days, and then anything else. How is your vacation accrued? That is very important to know. I can tell you for our organization, for our dental assistants, roughly every paycheck, they will see between 3 to 4 hours that are accruing on their paycheck. As an organization, the organization I work for, we have 2 floating holidays on an annual basis. So the 2 floating holidays were something that were new to our environment and added. It wasn't always there. That was something that we can use throughout the year. And then we have our sick pay that will differ state by state, so please be aware of that too as well. Another piece of the pie that you guys may be interested in to see if your employer has, but what about tuition reimbursement? Many of you guys are looking for a career path and may need to go back to school. Does your company support that? And what does that look like? As far as tuition reimbursement, what is the clause? Do you have to sign something? Do you need to stay with that organization for X amount of years? But Sam, any other thoughts when it comes to total compensation? I know I didn't hit on incentives too. That is another piece of the pie to also look at.
I think you hit the nail on the head just in terms of, importance in what's important to you and what that means in an overall plan. So I think that, the base compensation is always important, but I also think that it's the opportunity within the organization for learning and growth. Where do you want to go? Do you want school to be a part of the future? But I think that you hit all the things really on the nail of the head, Rose, just in terms of, thinking of it as a whole, as a picture. Because compensation typically, benefits and those type of things are usually about 28 to 30% of what we consider total compensation. So in addition to your base salary, your benefits, your sick time, vacation time, and 401k, all of those things should amount to about 28 to 30% of additional compensation in a total. So remember that number, because if someone's offering you an hourly salary, but you have all these other benefits, that's in addition to what a total compensation package is.
Yeah, thank you, Sam, for that point. And then I want to hit on flexibility teams. I do think this is important. Flexibility is going to be unique for each organization you join. I was championed from clinicians and hiring managers and management to attend school full-time and work, but it didn't come with an easy pathway or this yellow brick road that was paved out for Rose. It came with, some, that I needed to do X, Y, and Z, or this was expected. So when you're looking at flexibility, there are going to be organizations that provide that for you if that's your definition. For me, it was to have a day off during the week, but the expectation was that I was working every Saturday because our patients were coming in on Saturdays. So the flexibility was, Rose, yes, you can go to school, you can have a day off during the week. I was able to take classes, but then the expectation was that I would be there on Saturdays to support our patient flow and be able to support our clinicians, to provide our communities the dentistry that they were needing. Access to care is huge right now, and the amount of hours you can be open is crucial because we picked a career that is a healthcare professional, and providing our patients access to care in the communities we serve is essential. We are essential. So I want you guys to think about that when you guys are working through organizations. There are going to be some organizations that can provide you additional flexibility, but your comp may look different. So again, to Sam's point, it's going to be what's important to you and what do you value, and being able to now streamline through some of those decisions on who is going to be in your employer. One thing I encourage you guys to think about too is what's valued today, or what's your top priorities today may not be your top priorities 2 years, 3 years from now. So it is okay to go back to an organization that you originally said no to, but now aligns with you 2 to 3 years or what your family needs here at this point. So just keep that in mind. Now we're going to go. So now we know what we want in an employer, right? But where are we going to find these employers? I'm going to hit on network, and I'll have Sam chime in a few on all of these teams. I'm going to give you my perspective of in the last 6 to 8 months what I have seen with COVID and working with different allied health professionals, being on advisory boards, and some things that stick out to me. So network, I want you guys to write Facebook down right now. The reason I'm having you guys write Facebook down, traditionally when we were pre-pandemic, networking would be, attending job fairs, which we have here. It would be meeting people or being open to any type of event that may be related to your profession or your profession in the healthcare system attending. But social distancing is in place now. With that, I have learned a little bit I would say the last 30 days about Facebook groups. And there are tons of Facebook groups, team, from dental assistant face groups to MAs to PAs to RNs to pharmacy tech. I encourage you guys to all join these Facebook groups. So what you would do is you would go onto your phone, go into your Facebook, type in like medical assistant. You're going to see groups start to populate. You'll join it, usually ask you to fill out a little bit of a short survey. So it'll tell you like, are you a current MA, in what state, how did you hear about us, where are you practicing, or where are you hoping to practice. Some of the groups are really exclusive to, they only want MAs in them, they only want dental assistants or RNs, so be aware of that. But what I love about it, it's a live chat room with MAs, with dental assistants, with pharmacy tech students or pharmacist techs from across the country. And what I've seen my other allied health professionals do and my other, counterparts do is they'll type something into our chat that's going live feed and say, I'm looking for a job in such and such, or I'm interviewing with Kaiser on such and such day in such and such county for this role. Does anybody know the going compensation for them? What is their base pay? Any tips, any advice? What should I be asking for? And you're gonna get on real time others peers from across the country responding to you. So it's a great resource in that. Or I've also seen students entry level type into the chat, I'm just about to graduate, any advice of where to go for externship, what organizations, what companies, and you'll get responses. I'm going to give you the example that really hit home for me. So in these Facebook groups, I am a dental assistant, but what I was doing is in the state of Virginia, there was some dental assistants that were posting of, oh, our office is going to be shutting down. It's private practice. We're now looking for work. Does anybody know of anywhere to work or doctors or clinicians that are hiring? I immediately replied to that chat and said, oh, yes, we're looking for DAs or dental assistants in Virginia. I work for such and such organization. Can you please send me your resumes? Within 5 minutes, I had 5 dental assistants' resumes in my inbox. And I thought, wow, how instant gratification is that? It's Amazon Prime for today working, but it's to find a job or land a job. And then from there, I was able to support those dental assistants and get them in front of hiring managers. So keep that in mind as you guys are going through your job hunts of leveraging that from Facebook. That's really my big takeaway during this COVID and this last 8 months. I'm still doing more research on how you can leverage it, how you can network, but you're connecting with thousands and thousands of other allied health professionals in seconds. Job fairs, what I've seen in a virtual setting, you're almost entering like a video game. So if I was on a video game and I'm entering, like if Disneyland went virtual, you know how you have all the little lands that you can go into from, I don't even remember, like Frontierland, that's coming to my mind right now, and you can go to another land, another land. You guys are almost visiting each employer, but virtually in a video game. So you would enter the virtual career fair and you're able to see Kaiser, CVS, if maybe you're a pharmacy tech, Pacific Dental Services, Heartland, and Aspen. And they will have someone virtually there for you to respond and interact with, ask questions about the organization. There's usually something that prompts you where you can upload your resume into their queue, and then they'll contact you at a later time. Take advantage of them, team. It's a great place to go where you could spend 30 to 60 minutes and connect with recruiters or hiring managers all at once. But that's what I'm seeing in our virtual job fair. And we'll see what 2021 has in store as we hopefully see where this pandemic takes us in the coming months. Externship, hands down, this is your bread and butter. You guys get in front of a clinician, you get in front of hiring managers, and it's a on-the-job, training, and it's work experience. This is time for you to show all of your skills and put them into action with your patients. So please, that is why I stress, have a voice in where you want to go for externship. Who do you want to be an externship with? What clinician do you want to work with? Do you do your homework and look up Yelp reviews? Do you look at them up on Glassdoor, Indeed? What is the community saying about the organization or the clinician that you're about to work with and partner with for patient care? And the last is scholarships. I think this is one that kind of gets pushed back and we don't really think about. There's tons of scholarships out there to help you guys with tuition. As I mentioned, there's one that I work with through the PDS Foundation for dental assistants in the amount of $5,000. And what I've learned about scholarships over my last, I would say about 2 years I've been working with the PDS Foundation on their scholarship is it provides you so much more than financial support. It can provide you the opportunity to serve your community and give back to them on a local level and regional level or national level. It provides you the opportunity for maybe employment and on-the-job training. And then your network grows and you are now connected with other stakeholders in the industry. For this one, this scholarship that we do for dental assistants, not only are you connected with dental community, but some of our stakeholders, such as maybe you want to work for an Ivoclar or Sorona, and that's some of the organizations that supply the material for our dental offices. Henry Schein is a big one for all allied health professionals, hospitals. Gloves come from there, tons of PPE comes from Henry Schein, Patterson the same way. You don't know if your path is going to take you along and you'll be working for a vendor. So be open-minded to that too as well. Sam, is there anything that you may want to add from the job hunt perspective?
No, I think you did a great job, Rose. I think that, when you talk about networking, the one thing that I would also do is just really stay connected with your school, stay connected with your other students. When people start finding positions, they start talking about their employers that they're meeting. So in terms of networking, that would be the other thing that I would do. Just asking questions of people who are getting employed, going out there and looking and just being really, looking for employment and being really an advocate for yourself out there.
Thank you, Sam. Great point. Okay, how to apply. DAs, I know dental assistants, pharmacy techs, and MAs. So where do you go to apply? You can definitely visit a company's website, whether, Pacific Dental Services is up there because the organization I work for, but Kaiser, CVS, it may be a medical clinic that you're going into, wherever it may be. LinkedIn, we're going to talk about, so hold on to that idea. But Indeed and Glassdoor, I really want to hit on. Sam, do you want to jump in as a candidate that's seeking employment? How would you leverage Indeed or Glassdoor as that entry-level health professional?
I think Indeed and Glassdoor is always, I continue to use it just from a recruiting perspective to look at what employers are out there. What are you seeing out there in terms of jobs? You're able to get a really good picture of the job market when you're utilizing Indeed and Glassdoor. You're able to see what people are saying about them, their ratings, information that you're going to be able to utilize. But it really is a great place for you to start figuring out like where maybe there's employers that you've never heard of that you'll be able to then go Google and find out a little bit more about. But those are great places to start learning about the different employers that are out there. What are you seeing out there? And utilizing them to really start your job search. Because as a large employer, and even when I worked for smaller companies, these are the two go-to places. More than some of the other job boards, I utilize just about everything. But if you want me to pick the top 3, Rose has picked them right here. Glassdoor, Indeed, LinkedIn. These are all my go-to ones that I've been using for many years. But I would say right now what rises to the top is definitely Indeed is my first go-to. It's where most people find it easy to update their resumes and definitely get connected. But definitely in terms of what you're seeing out there, these are the mainstays of where you want to go to and look.
Thanks, Sam. I want you guys to write 3 bullet points down of how I would use these. I am an entry-level, healthcare professional. I'm entering the workforce. Key things that I would be looking for, team, if I was using these or leveraging these resources. Indeed and Glassdoor are going to give you reviews on employers. But with a grain of salt, remember, good, bad, and ugly comes with reviews, hands down, whether it's Yelp, Indeed, Glassdoor. Take that and use that to be able to look through a lens. You're looking through that individual's lens when you're reading their review. Then you're looking through the next person's lens of this organization when you're reading that review. How I would leverage this going into the interview process, again, if we go back to when Susie asked me, because I was interviewing for a pharmacy tech at CVS, and she'll ask me, Rose, do you have any questions for me? No, Susie, I do. I was looking at Glassdoor and Indeed, and I found a few reviews from current employees and former employees that have been pharmacy techs for your organization. And I just wanted to get your feedback. You've been with the organization for 5+ years. Just really seem to enjoy the organization and all the attributes and have been able to excel and grow here with CVS. Can I get a little bit more insight to such and such review that I read from one of the past pharmacy techs? Give that hiring manager the opportunity to speak to it, because you don't know what processes have been put in place or what the organization is working on to help support maybe some of that feedback that was provided on a review. But take it for the grain of salt, team. Good, bad, and ugly comes with reviews. And you as well as I know, when do you write a review? When you're really, really happy or when you're really, really upset? I can tell you in my experience.
That's a great point, Rose. The one thing that I would also say is during this time frame, you would always want to ask, what are the challenges and opportunities that I'm going to have in this role? Every job has them. Every job is going to have challenges and opportunities. Typically, employers do know that, but Rose is right. As soon as somebody gets really upset and leaves, that's when they typically write the review. So it's definitely a question you want to ask, but also be open to hearing about what the answer is going to be from the hiring manager.
Yeah.
That's a great point, Rose.
So take it for the grain of salt, because I hear it all, I see it all. The other thing I want you guys to jot down, so that's your first bullet point. The second bullet point for Glassdoor and Indeed is you're looking at pay ranges or broadbands of a specific role in that organization. No, these can be skewed. So again, take it for the grain of salt, because data is being pulled in, but is all of that data accurate? It's just like you take a survey. Take a survey, depending what area may have pulled more or been able to get more responses, it can be skewed. But again, it's another starting point for you, because if you took that information and then you went into maybe a chat room at Facebook and, hi, MAs, PAs, or hi, allied health professionals, I'm interviewing for such and such organization. I pulled this from Glassdoor. Any thoughts? You can use as another resource. But then you're also going to align it with maybe what your school is providing you as what is the market offering as base pay for an entry-level healthcare professional in your company. So that's another thing I would just be aware of, team. It can be skewed, so be aware of that, but it is another resource of items that you can look. You can type in any role and it will pull this algorithm of the base pay for that. Those are the 2 bullet points I want you guys to take away from Indeed and Glassdoor. LinkedIn, we will get to, because there's some fun little nuggets there with LinkedIn that they've recently put within the last 8 months that are very important. And I encourage all of you guys to create a LinkedIn. So let's hold on to that thought. Applicant tracking system. So ATS, we're going to write this acronym down too as well, because I can tell you as an entry-level health professional, I had never heard of this word until about 2 years ago when I started presenting on this. But ATS is an applicant tracking system. I'm going to have Sam take this slide, because as a recruiter, her background is in this and she uses this on a daily basis. So she'll be able to give you some really good insight on how it's leveraged when you guys are submitting your resumes into the system, because not always does a person look at your resume first. It may be a system. So Sam, I'll let you take this one away with the applicant tracking system and just some tips and advice when they're submitting the resumes.
Yeah, thank you, Rose. So an applicant tracking system is used in so many different employers, from small employers to large employers. We all have different ones that we utilize, and they're all used in a different way. However, typically what it's meant to do is to create an efficient process for us as recruiters to look as many candidates as we can, to be able to put our information out there in the world, and that we want to get as many applicants to us. So with that, we always have a high level of volume of resumes that were coming in. So when you go in and you apply, typically you're putting together information in a profile, and a lot of the applicant tracking systems have questions that they may ask you in terms of, you know, what you're looking for. Those applicant tracking questions are really meant to help us identify the candidates that are the best match for our positions. So it's kind of something that helps us get through a number of applications quickly. Once you've so take the time, if you're going to, I know sometimes it's easy, you're kind of on your phone or you're, you know, in an easy place where you can kind of put in some applications, and we as employers try and make it as simple as possible for you to put in information. I will tell you today alone, I had 3 applications that had no resume at all. So for me, I can't do anything without any resume at all. So you want to make sure that you're taking the time to put in the information so that when you are applying for a position, you have all your information there. So you want to make sure that you fill out the profile completely with contact information. And again, we try and really minimize it. So it should really just be your name, your phone number, and probably your email address, and then your resume. You're not always required to put in a resume. Excuse me, again, we want to make it easy, but again, as a recruiter, I can't do anything without a resume. Your resume, really specifically, if it's being used, whether it be an algorithm or whether it be a person, it's really simple. I will tell you that you probably get about 30 to 45 seconds of my attention to go through your resume and look to see if you might even be a good match for us. So what does that mean? It means that you want to tailor your resume to the specific job that you're applying for. In the first couple lines, I want to know what you're applying for. And I will tell you that people will say, I'm looking for, you know, a receptionist job, and they've just applied for a dentist job. And it happens all the time. So you want to make sure that the job that you're applying for is tailored into your resume, and that you're using those keywords of what you're looking for throughout your resume. And as new professionals, you're going to have an opportunity to talk about your schooling and talk about the program that you're a part of, especially as getting into your new career. You definitely want to indicate that you are looking for a medical assistant position or a pharmacy tech position within a strong organization. That objective can sometimes be helpful because you're putting in exactly what you're looking to do, because your background doesn't necessarily reflect what you're looking to do. As an allied health professional, you definitely want to keep your schoolwork and your school and your information up at the top so that we can look at it quickly and easily and effective. So I should be able to look at your resume and know exactly what you're applying for, and that you've got the skills and schooling to support that. So using those keywords is really important. If it's being looked at by an algorithm, those keywords are what's going to be important as they go through. The more times you use those keywords is important as they look at it through your resume, and the algorithm will pick up those keywords. So if you're a medical assistant and you put in the subject line or the objective, you're looking for a medical assistant position, and then you go to your schooling and saying you took a medical assistant certification program, and then you put in the information that you volunteered as a medical assistant externship, the more times you use the words they're looking for, the more times that your resume will kind of, what I would say, float to the top or rise to the top because of the keywords that you're using. So they are important. You definitely want to use them as much as possible. You guys all have access to an organization that's going to support you in your resumes, and they are able to help you make sure that your resume looks good. So I would utilize them and absolutely make sure you're taking full advantage of your school's career advisors and making sure that they're helping you with those resumes. And then just quantify your accomplishments, I would say very specifically, especially when you're coming from school. If you have, perfect attendance, if you have a 4.0 grade point average, if you took extra courses or you did extra volunteer work, All of those things you should be putting in your resume. Those are things that make a difference when we're looking, because you are in school and you're being educated. What things did you do to help you get through your education? What volunteer events did you participate in? Were you, student of the semester? Whatever it may be, you definitely want to put your accomplishments on your resume as well. And again, you have a great school that's supporting you, that should be able to help you. And we're here to help you as well. Both me and Rose love to look at resumes and give you advice and feedback as well.
Thank you, Sam. So team, the sections of the resume, I'm not going to spend too much time on. This is something that, like, me and Sam definitely champion to leverage your career services teams as resources. Take them down as bullet points. I just really want to hit on contact information. I was able to work with numerous entry-level allied health professionals for about 90 days. I was calling you guys, texting you, emailing you, and I really got brought up to speed on how our contact information could use a little bit of a polish and when it comes to professionalism. I'm going to give you a little bit of feedback and be very transparent. Let's start with emails. If your email belongs on a meme, a bumper sticker, or a billboard, or a hashtag, it needs to be changed to professional. This email is consistently showing up in a hiring manager's or a recruiter's inbox. You don't want to be remembered for your email. So please, you want to be remembered in a positive light, not a humorous light. It's kind of the same way when you're picking an outfit for an interview. You don't want to be remembered for your outfit, or if you question it, you should change. One thing that I would recommend to an entry-level, healthcare professionals entering the workforce is using your last name, first initial @gmail.com. What that does is your name is now going to consistently pop up in that person's contact information with your last name. Before they even click into the email, they know that Smith J is contacting them. Oh, I just interviewed Smith J. I was supposed to follow up with him on Tuesday and let him know about the next steps for the interviewing process. Let me make sure I get back to him today. I've seen it in my inbox. Or a lot of people are using mobile devices for their phones and contacting and communicating with people through their mobile devices. So that will also pop up very quickly on their screen of who is contacting them. Now let's go to your phones. When I see all of you guys in person, I usually call a cell phone in the room. I'll call a cell phone because I want to hear what the voicemail sounds like. It's very amusing to me. You guys give me a good chuckle and a good laugh, so you keep my day going. When I call you and your voicemail's full, not set up, or set up, and it has a very humorous tone to it or comments to it that are not professional at all, please ensure that your voicemails are not full. They're set up, ready to go. And when I say set up, they have your personal brand on there. It's, sorry, thank you for reaching such and such person. Sorry I missed your call. Please leave your full name and your full number, and I'll get back to you as soon as possible. However you want to lay that out, that it's polished, it's toned, that is your brand. When you are seeking employment, there are going to be recruiters and hiring managers calling you. That may be your first impression besides your resume into who you are. And you're starting your journey with other stakeholders, with industry leaders. What do you want to be known for? So that's really what I want to hit on here with contact information. I'll let Sam kind of chime in with response time, because I think that's the other part of this, of when should you be responding, and you need to be responding to emails, texts, whatever form of communication the recruiter or hiring manager is using. But Sam, I'll let you chime in if there's any specific sections of the resume you want to hit home on.
Yeah, so I think there's two that I probably want to respond to. And first is the contact information. So it's very difficult now. A lot of the resumes come in. So I'll give you an example. I had a resume dropped off, and it had a name and it had an email address. Had I had a phone number, I would have called that candidate right away. But I didn't have a phone number. I also don't know where that person is living, because it literally just has a name and an email address. So I don't know what job she's looking for. And when you live in places that have, a diverse amount of positions in a variety of areas, it can be difficult to figure out where somebody wants to work. And so it's a little more challenging for me to determine where is this person looking. And so I recommend to put your name your email address, your phone number, and a city of location that you're looking to be employed in, whether it be your current location or where you're looking. But it definitely helps us go through and determine where they're looking for. I will say that if you're not looking for a local in your objective, you can put looking to relocate to, and that can sometimes help if you're in the process of relocating as well. But again, I need to have it in a very short snippet. I need to be able to read right on top of what I'm looking for, because you may not get a phone call. I may go to the next one that's a little easier to connect with if I don't have what I need at the beginning. And I think that the response time is important. When you have a full voicemail, as Rose indicated, that indicates to me that you're not actually serious about looking for employment, because you're not responding or you don't have the ability to respond quickly. I would definitely be listening to voicemails and to responding to text messages, because we are also reaching out a lot that way. But typically, the people that respond to me the quickest are usually the ones that float to the top and get to the hiring managers the quickest, because they're showing energy and that they're interested, and we know these people are really wanting to move quickly and respond to us quickly. So the people that respond quickly to our responses to our emails and to our phone calls are the ones that typically get to the hiring managers the quickest. So I had a phone call today with a candidate, and she's like, well, I saw your position open. And I said, well, you just applied yesterday. She said, yeah, I wanted to see if it was still open. And I'm like, that position's already been filled. She said, oh, well, I still saw it posted. I'm like, yeah, no, it was filled a couple of days ago. So positions are being filled quickly with the candidates that are moving the fastest. So please understand that when somebody reaches out, if you're really looking for a position and you want to get the position you want, it definitely response time is going to mean a lot.
Perfect. Thank you, Sam. Team, so last item we're going to hit on that way and speak to is LinkedIn, because I think now more than ever, LinkedIn is going to be relevant as you guys enter the workforce. So just a quick bullet points for you guys to jot down on LinkedIn is you want to make sure all of your sections are filled out. I always talk to you guys and speak to you is you would never submit a resume, I hope, that was incomplete. So why would you put a live resume or a resume that's, in one aspect live and an ongoing brag book of who you are out there for everyone to see? That's your brand. That's how you're starting. You're building your network through LinkedIn. So please make sure all your sections are filled out. Your profile picture, please have it be professional. You should not be taking a selfie or being photobombed by a peer or a friend. So please be mindful of that. Are scrubs acceptable in your profile picture? Yes, 100%. If you want to, throw on a scrub top, have a neutral background, that is more than acceptable. You want to build your network. Start adding people, organizations. It's just like Facebook, Instagram. The more you like things, the more you post, the more you interact and engage with it, it's going to benefit you. You can search and apply for jobs. You can research on companies and then be active. I'm going to have Sam jump in here too as well. The last note I want to leave you with is LinkedIn recently, and Sam can speak to this better than I can, is put like ready to work on like a button that can surround your profile picture. And what that does is it lets recruiters know, or anybody in the industry know, what you're pursuing. I am looking for a job and I'm ready to work today or tomorrow or the next day. And the last note I want to leave you on this, continue to build this even if you're happy where you are in your career. I did not use this in my early parts of my career. In the first 5 years of my career, I probably barely started using it within the last 4 years of my career. And I was, my eyes open to the possibilities that it can create. Even if you're happy with the organization that you are at, you may be pursued by a hiring manager or a recruiter because based on your skill set or what's in your bio, you fit the job profile of the role that they're trying to fill for their organization. And they will reach out to you. They will slide in. So instead of sliding into your DMs, they will slide into your LinkedIn messaging and ask, do you have time to chat? This is the opportunity with such and such organization. And just like anything, team, dating, it's nice to be pursued. It's also nice to be pursued by other organizations to see what else is out there that you may have never even thought about in your career path. That's really what I want you guys to see big picture with LinkedIn. It's not just for today, but 5 years, 10 years from now, how do you want that to build and what opportunities do you want presented to you that you never thought were possible? Sam, I'll pass it to you to give some insight to LinkedIn because I know this is your wheelhouse as you guys work with it.
This is my fave, just so you guys know, regardless of the industry that you're in. Just to give some clarity to kind of what LinkedIn is, because it may be new for quite a few of you. LinkedIn is basically a social networking opportunity for a professional career. So what it's really meant to, and as a recruiter, the way that I use it is I am there to connect with other professionals, not only in my profession, but also in the areas that I am pursuing. So I'll use dentists because that's what I reach out to a lot. So I look for dentists in the offices that are looking for a new dentist. I am reaching out to local dentists in that area. It can be in Nevada, it can be in Colorado, it can be in Reno, but I'm starting to look for dentists in that area. And then I'm reaching out to them and trying to connect with them via LinkedIn. Now, the way that I build my network is I'm reaching out to people and asking them to be in my network as a recruiter. If somebody joins my network, I then have access to their network. And I also have access to their network, so 2 and 3 deep. So the more people you're connected with, the more access and resources you have to additional people to build your network, as Rose indicated. So when you're in a medical assisting field, you want to connect with your people in your school, you other medical assistants. You may want to reach out to office managers in medical offices. You might want to reach out to other organizations. So you're building your network and you don't have to know them and you don't have to be connected with them in any way. It's literally you trying to build your network. And if you're on LinkedIn, most people know, and I get invitations every day for people that would like to connect with me. And if you are in the recruiting field, the dental field, the marketing field, whatever fields that I support, I'm going to say yes. And so it gives me access as a recruiter to multiple people. So now, as a recruiter, if I'm looking for a pharmacy tech in Irvine, I'm going to go reach out to all of my pharmacy techs that I have in my network, and I'm going to say, I'm hiring a pharmacy tech in Irvine. Who do you know that might be looking for a job? And that's how we get a lot of our referrals, and that's how we build our network. And so not only will you have an opportunity to say, hey, I may know somebody, but then you may say, you know what, I just started my job search, I am looking myself. And so that's how you build your professional network substantially as you go out there. I will say that dental assistants, medical assistants, and pharmacy techs definitely have an opportunity to grow your network and continue to build. I think that LinkedIn offers one additional avenue for searching for jobs, looking at organizations, being able to see how the organizations are presented in LinkedIn. I always present our company and ask our students to go follow our company or follow Rose because she does webinars. And they always get posted on LinkedIn. So you are able to also educate yourself and really have an opportunity to build your network and your profile. It's a great way to be educated. It's a great way to follow people that you think are great in your industry. You know, I never lose a chance to try and connect with people within my organization and outside to build my network. So it's definitely something I would utilize. You're going to get a lot of benefit from it, both in your career. The one thing that I wanted to say that I didn't say in the last session was, the other thing is that I really appreciate is when you're asking people to give you references. It's an on-the-spot reference, and you can literally go in and ask a teacher or an advisor to give you a good reference. And it's a great opportunity to just have people that say great things about you in your profile so people can look at. So it's a great way to build your network, build your profile, and build your career. I can't endorse LinkedIn enough. It is, from a recruiter's perspective, it is definitely one of my best friends. Every day I'm in it. So I would definitely highly encourage you guys to use it.
Oh, thank you for that, Sam. And then the last bullet point, team, I want you guys to jot down is ensure when you guys are looking for a job, because this was brought to my attention by, people that I work with, network with, but your resume and your LinkedIn always need to match. As you grow in the industry, one tends to continue to be updated. It seems like the other one doesn't get updated, meaning your resume is updated, but then when someone goes and looks at your LinkedIn, it may not be as updated. So just remember that as you guys are actively pursuing your careers, jobs, elevating yourself in your industry, ensure that both of them match, especially when you're actively pursuing employers. That way, when a recruiter goes to look, a hiring manager goes to look, there's no question. Both of those resources match and are to the T, on point. I'm going to stop the share for a moment. And do we have any questions that we would like to know about the industry, safety-wise, or what's going on in the industry at all from any of the groups? I'll give you guys a moment to type into the chat. If there's no questions, please let us know via the chat too as well. We can just put no questions in there. Perfect. Well, Vancouver, Lancaster, you guys, thank you so much for having us. Team, if there's anything else we can do, Sam said it earlier to the group and just want to echo it. Congratulations on making it this far, going to school and pursuing a career that is hands-on and engaging when some of you guys are virtually online 50% of the time and then the other 50% in the classroom. Kudos to you. And we look forward to you guys joining us and supporting, the communities that we all serve in one capacity or another, whether it's, with animals, whether it's with patients, as a medical assistant, pharmacy tech, or as a dental assistant. You guys are entering a great career, and we wish you guys all the best along your journey. Perfect. Thank you, team. And for all my program directors and instructors, I'll be working with Allison to get this one edited, and then it'll be available. Give us around 2 to 3 weeks to work with our teams to get it edited, then we'll send it out to you guys. Thank you so much, Charter College students. You guys have a wonderful evening.
Good luck. Take care.